My name is Annette Janelle, and this is my husband, Brett Janelle, and we are co-hosts of the Retired Living Truth Seminar Series. I seem to be getting the backlash.
Feedback.
Yeah, that feedback. Thank you. Some of you have actually pointed it out to us how much we've grown. This is not good. Let me try this. Can you hear me better? Thank you. This is much better. Oops, yeah. Some of you have pointed out how we have grown so much from where we started. We used to be at the library, and our smallest group was 9 people, and now we had 180 people register for today's event. So we're very excited, and part of that is we have been really pushing to let more people know about the seminar series. Not only us, but you have as well by inviting friends, so we really appreciate that. One of the things that Brett and I did was at the end of last year, I think, we went to the Senior Advisory Board in Sparks. They invited us to speak and talk about the Retired Living Truth Seminar Series. And one of the, what do we call her? No, she's not a panelist, but one of the people that was there, she asked us.
Members of the council.
Yes, members of the council. She asked us, have you ever done anything on mental health? We are always looking for new topics, and that is one topic we've never approached before. So today is the day we're going to be talking about mental health. And it was all because of one person mentioning it to us. And I just want you to know the power of you speaking and you letting others know about what is important to you. We want to know what's important to you. If it is, and we see that there's going to be enough of an audience draw, we will talk about it. So thank you for that.
And the reason that they brought it up, the Senior Advisory Council realised what a big challenge mental health is here in this area and across the country. And we just need to talk about it more. As one of our panellists talked about, there's a lot of stigma around talking about mental health, death, and topics that we just need to talk about because they impact, death impacts all of us at some point. Mental health impacts so many. Having sound problems over here, Bryce, can't hear. We're working on that.
We saw you on the news.
Oh, sorry.
Yes, thank you. Actually, thank you for bringing that up. We have been on the news, and it is because of the fact that we're talking about mental health. So the different topics that we're bringing up, news channels have been reaching out to us to be able to talk about it and bring it out to more people so we can have more people come here. And if you know anybody else that this information would benefit, please invite them.
Right.
Yeah.
Thank you, Annette.
Thank you.
So can I have my panellists come up and join me while Bryce is working on the microphone challenge? Annette, could you just take that one back?
Yeah.
I'm just curious, just a show of hands, who's here for the first time today? Wow, welcome, thank you for being here. And who's been to more than 4 seminars? Well, a lot of people. One of the panelists asked, how often do people come? Obviously a lot. So let's jump into it. So if I can start with you, Abby, if you could introduce yourself to our audience.
Good morning. Can you hear me okay?
Yes.
All right. My name is Abby Battalato. I'm from Washington County Senior Services with Human Services Agency. I'm the coordinator for Senior Services, so I oversee all of the programming that the county does for Senior Services. So that is the nutrition program, it's our senior centers, it's case management, it's homemaking, Representative PE, so all those services fall under me. I've been with the county for about 20 years, and I have been in this role for 8.
Wonderful, thank you, Abby. Shelby.
My name is Shelby Green. I'm a licensed clinical social worker, and I serve as the coordinator of clinical services with Sanford Center for Aging, which is part of the School of Medicine at UNR. I work within our comprehensive geriatric assessment, and I work with all departments within the Sanford Center.
Thank you, Shelby. Welcome. Teresa.
My name is Teresa Whitfield. I am a, nope, not working. How about now? How about now? Better? Okay, my name is Teresa Whitfield. I'm a registered nurse and I'm working at Northern Nevada Medical Center, and I am the director of adult mental health services at Senior Bridges. We have a adult psychiatric unit, and we take patients 50 years old and older currently. I've been a nurse for 41 years. I've been at Northern Nevada Medical Center for the past 10, and there is always something new and different every single day. Every one of you I know is unique in what you need, and that's our job, is to provide what you need that is unique to you.
Thank you, Teresa. Right, so we'll turn Teresa up just a little bit. Well, so maybe I can start with you, Teresa. Could you just tell us a little bit about, as we age, how our brain changes and how our mental health could be impacted?
In a nutshell, really, the bigger change is as we age and get to 70 and older.
I can't hear.
Okay, so bigger changes happen at 70 and over 70. And these are really just a slower response to questions, a slower response to recalling information. There's several different categories that we look at, and I brought a few notes to help. And usually normal aging is just a little bit more slow to recall and bring forward information. Then there can be some mild cognitive impairment, and at the other end of the spectrum, dementia. All right. The average age of the patients currently that we see with dementia is generally mid to late 70s, more so early 80s. And then as we look here, one of the examples for language as an example is that just naming objects, not remembering the name of something or the word that you specifically want to use. And one of the questions that we ask is for people to provide for me all of the names of the states that begin with the letter M, and look for those kinds of recall.
We're working on the sound as best we can.
The speaker needs to hold the mic to it.
Teresa, yeah, if you can just hold the mic closer.
All right.
Yeah,
So-
that's better.
One of the other things that happens as we age, it has to do with psychomotor functioning and connecting everything that you want your body to do and sending that signal from your brain to the rest of your body. Some of the patients that come or are referred have had recent falls. So encouraging people to continue to practice new things or stay connected to activities is very important, especially things that are mind-body related. Tai Chi, chair yoga is a good thing to do, as well as activities that will keep you moving. Golf. There's a lot of exercise that's still involved in that, but it can be at a slower pace rather than, say, marathon running or something else like that. But the mobility, and those are the questions we're going to ask. Through the Institute for Healthcare Information, we follow a 4Ms guide to taking care of patients. We want to know what matters to you, what things are important to you to be able to continue to do, what medications you're on, what your current mobility is or your goal to mobility. And we're looking at mentation and how we can support mentation to be able to meet those goals.
Thank you, Teresa.
Mhm.
So maybe Shelby, can I ask, what are some of the symptoms of suboptimal mental health? Sorry, I think my microphone's also challenged.
It's okay. So when we're thinking about our mental health, we really want to think about the two things that impact older adults the most. Depression is a medical condition that impacts 7 million people over 60 in America. The statistics are a little different based on the level of care that one receives. So typically, if someone's living independently in their home, it's about 5% of individuals. If someone's temporarily hospitalized, you're going to be impacted typically about 10 to 15%. And then someone that lives in a facility. And the statistics is a little different, but anywhere between 14 and 40% of individuals experience depression. What is depression? Depression is a medical condition that actually is categorized by symptomology of lower energy, poor sleep, low motivation or interest, along with many other things.
And so why does it affect us more as we age, potentially?
Typically, we're impacted by depression and anxiety because of the experiences that you have. Loss of friends and loved ones, loss of control, loss of independence, or the feeling of independence. It's typically due to challenges we're faced by.
Thank you. Abby, do you have anything you'd like to add?
Hello? Okay. I turned it on. Not a whole lot. I did want to, as we start to talk about mental health and as we age, I do want to put it out there that it's less stigmatized now, and I think that it's important to talk about that there has been a stigma around mental health, depression, and people not wanting to ask for help because of those reasons and because of that stigma. We're all here to say that that stigma is really dissipating. I've seen it even in my 8 years. COVID really, I think it got a lot of conversations around social isolation and depression. So I want to put it out there that that stigma is not as relevant as it used to be.
I'm going to add just really quick to that. What we see a lot is someone saying, I feel low, I feel different, I feel tired, I feel exhausted, I feel like I'm not remembering things like I should. And instead of categorizing that as anxiety or depression, we're just saying, I'll work through it. If you had a broken leg, would the doctor tell you to just walk it off? No. So why are we walking off our depression?
So just going back one, so depression is one form of mental health. What are a couple of the others?
So as I mentioned, depression is probably the biggest category within mental health in terms of an older adult experiencing mental health, but then there's also anxiety, personality disorders, mood disorders, several other categories, but the ones I wanted to talk about today were depression and anxiety. Depression, like I mentioned, is going to impact sleep. Are you sleeping too much or not enough? Or if you're thinking about a loved one, are they sleeping more than usual? Are they refusing to come visit? Are they losing interest in activities that they once were interested in? Are their appetite either increasing or decreasing? Some of the other things are going to be activity level, irritability. So irritability can both be anxiety and depression. So it really depends on seeking out help so that they can get a proper diagnosis, because these are very treatable conditions.
Thank you. Teresa?
I think one of the goals that we have is that people have between 7 and 9 hours of sleep. That's a goal for us. Of course, everyone's different, but 7 to 9 is our goal. The other thing that we want to look at is what's preventing people from sleeping, and make sure that you're talking to your primary care physician about things you're concerned about, worried about. Is there obstructive sleep apnea as part of what's keeping you from sleeping? Because not enough sleep affects your mentation and your memory. So good sleep hygiene is very important.
So if we're not getting that 7 to 9 hours, we should be exploring further.
Correct.
And why is that so important to get that amount of sleep? I know, like for youth, for young children, that's obviously part of growth. But why, as we get older, is the sleep so important?
I was just going to add that it's also thinking about, are you able to fall asleep easily? Are you going to sleep? Are you knocking out? Are you utilizing something to fall asleep? Are you waking up throughout the night? There's multiple types of issues when it comes to sleep, but then I'm sure Teresa's going to touch on this. But you really want to think about that time for your mind to really rest.
Agreed. You definitely need mind to rest. And what we want to avoid is polypharmacy, is what we call it. Multiple medications and those interactions, and some of those can be disruptive to sleep. And as we get older, I don't know about all of you, but as I got older, every 10-year milestone, my metabolism slowed down. I needed less and less, and of course I didn't pay attention to less chocolate or less food, so I went up a dress size or two. So if you think about it, sometimes less is more. And there are some medications and medication categories that we really don't want to see older adults taking because they can predispose other problems, right? Benzodiazepines, that category is one of those. We don't want to see people on lorazepam, Ativan, those kinds of things, because it really can impair your cognition and judgment and lead to more confusion and falls. So it's really important to have good, truthful conversations with your provider about what you're feeling and how things are making you feel. It's one of the reasons why we love the Sanford Center for Aging and their multidisciplinary approach to having a conversation not only with whoever the patient is, but also their family, so that complete information, well-rounded information comes to light, and you have the benefit of a pharmacist as well as a social worker and a geriatrician to look at things from all angles. One lady was falling and trying to figure out why, and turns out that the granddaughter that went shopping didn't know her shoe size and the shoes were too big. She didn't know to say anything, but it could be as simple as that. So having truthful, honest conversations is very helpful.
Thank you. Can I just go back a little bit to the start, just so we're clear? What am I looking for in someone else to know that their mental health is maybe not where it should be? What are some of the symptoms? We kind of started from the most obvious. We talked about depression, but what are the things I'm looking for in my partner to know that they're perhaps not doing well?
I think some of the first things would be if your partner is not able to complete basic activities of daily living. They can't remember how to brush their teeth, tie their shoes. Basic self-care is part of a first indicator.
Also, things like, I want to go to the store, but why don't we go to the store and I'll stay in the car? Feeling anxious or nervous about doing things that typically would be enjoyable or typical daily activities. We all are people that have anxiety. There is a natural ability to have anxiety. If we didn't have anxiety, we wouldn't show up to work, we wouldn't show up to this activity. We would be late to everything. It's when it starts to impede our ability to function throughout the day. And another big one that I see is sleeping throughout the day and irritability.
Wonderful. So I guess the next one I wanted to touch on is talking about suicide. That's something that's very prevalent. In fact, I had some statistics I've got on the slide. Bring those up. Hope you guys can see it. I'm proud of this, but our state is number 6 in the country for the highest rate of suicides in people 65 plus. In fact, when I was talking to Nevada, am I off, Jeff? I'm on. In fact, I was talking to the Nevada Department of Suicide Prevention, and apparently for 5 decades, our state was number 3 in the country for the highest rate of death by suicide. So mental health is obviously a big issue here. And one of the other interesting things they shared with me is that each suicide affects somewhere between 25 and 30 people surrounding that person. So it's not just the person who's taken their life, it's all of those people around. And what was the third one? The other one they wanted to stress was, suicide, talking about it, doesn't lead someone else to being predisposed to suicide. So part of the stigma you were kind of talking about, Abby, people just don't want to talk about it. One of the reasons the Department of Suicide Prevention said is because they're fearful that that would cause someone else, which is totally false. So I just wanted to talk a little bit about it because obviously it is a big problem in our community, and especially with our veterans, it's a higher rate there. So what do we need to know about looking for someone who might be having those thoughts, considerations? How do we detect that with someone, or if we're having those thoughts ourselves, how do we go about seeking help? I'd like to start with that.
I'll go ahead and take that one. So when you are have an individual in your life and you're noticing these changes, you're noticing that they're starting to talk about having thoughts that scare them, or thoughts that they would be better off not there. Little comments like that. You notice that they're sleeping a lot. They're not interested. They are withdrawn. Having a clear and compassionate conversation with them is going to be the most effective so that they know that you're there. Alongside that, some individuals actually don't receive this super well. So making sure that you remain available and you respect their autonomy to seek help is the most important. We're the experts in our own lives, but we're also the experts within our own families. So reach out, be clear and compassionate.
Teresa, do you have anything you'd like to add?
Just to piggyback off of what Shelby said, I think it is important to have those conversations. I know that the Office of Suicide Prevention, there's some literature out there. I just want to do a little plug that I encourage anyone to do the Safe Talk. Talking to people about suicide is not going to make them more prevalent to take that next step of killing themselves. And so don't be afraid to have those conversations, but also knowing it's normal to have conversations around death as we age. And so being really careful of someone might be planning, I want to get everything in place and this and that. And so having those really real conversations with them of, is it just a plan, for when they may pass away, or are you thinking about taking your life? And so having those conversations is difficult. Like I said, there's some literature out there that make it so it's easier to have those conversations. But talking about death is a very natural part of life in general. And so just being aware of that as well.
Thank you, Abby. And actually, you'll all have a handout there, a workshop. The Department of Suicide Prevention are going to do a workshop. Most of all, they're going to do a workshop with us in early July. We'll talk about that a little bit later. So what else should we know when it comes to this difficult topic? Because not only does it impact us in terms of potentially a spouse, but it could also be an adult child, a grandchild. What are some of the other things that we should be looking for? And then again, how to go about having a conversation that we haven't covered.
So one thing that you want to make sure you're doing, just as Abby said, is having conversations around death and dying. Having conversations, making sure you check in with loved ones, staying engaged in your community, making sure that your loved ones stay engaged. There are multiple ways you can do that. I know that Abby's going to jump in on these things, but volunteering is a great way to stay involved with your community and kind of distract, potentially, from things that may be stressing to you.
Do you have anything to add? Good. So let's talk a little bit about resources in the community. So in your handout, on the second page, we've provided a list of resources from our three panelists and other sources. So we just talk about some of the resources in the community. If someone is struggling with mental health in terms of where to go, what would be a good starting point?
Certainly. If it's not an immediate crisis, your primary physician is always your best bet to talk to them and have that conversation with them. If there is a crisis, there are the crisis hotline, the suicide hotline. If you are in a situation where it's crisis, you can always call 911. Our law enforcement has been equipped with a MOST team, so there is now the ability. It doesn't happen every time, but if someone needs mental health crisis intervention right then and there, it's not just a sheriff or RPD or SPD officer knocking on the door. That there may be a mental health clinician with them as well. There are resources out there in the community, therapy. You can work with your insurance to get into therapy, but again, that first step, primary care physicians know how to take those steps and can help navigate that. And as far as care coordination as a whole, we really believe in our senior, our community resources, but we work together to not have no wrong door. So if you call the senior center looking for resources, we're going to try our best to find that resource for you. If you call Sanford Center, they're going to do the same thing. If you call Access to Healthcare Network, who is the care coordination for Northern Nevada, they will do the same thing. And so we really strive that if you call one of our senior services, it doesn't matter who it is, we're going to try to get those answers for you and point you in the right direction and not just say, we're not here to help you, you can try this number instead. That's really what we strive for in this community. And I will say, we are a tight-knit. We have a senior coalition. We have senior advisory board meetings that many of us work together pretty frequently, and we'll pick up the phone and say, hey, I have this person. How can we help meet the needs of this person?
There's also you can text or call 988, which is actually the crisis support center, which you can immediately talk to someone or make sure that your loved one has that number. If they feel isolated, alone, that's when those negatives start to flood in. So 988 is a really important number.
Teresa, what would you like to add as far as resources in the community?
I think that this is a wonderful community to live in because there are so many resources. We have referrals from all over Washoe County and surrounding counties, and some of these resources reach into California as well. But this is a wonderful place to live and be a retiree because of the number of resources available.
Thank you. So can we talk a little bit about social support networks here, why they're so important, why the senior center is so important, why family, friends are so important in terms of having good mental health?
I'll take that one. I think in the first question, Teresa talked about exercise and engaging your brain and doing things as you age. So yes, we have the senior centers here in Washoe County. We have the main senior center on 9th Street. We have the Sparks one on 97 Richards, and then there's some other sites throughout Washoe County that serve meals and have some limited activities. Part of, just so everyone's aware, of our nutrition program is not just about a meal. We talk about our congregate meal program. That program is really designed to get people out of their home, to come and be social, to make friends, to talk. So there's very few people at our senior center that come just for that meal. They'll come early, have some coffee, hang out, they may play some games. We have bingo and poker, and so there's so many activities out there that are free that you don't have to pay anything. You can just show up to the building. We do have very light exercise classes. We have beanbag baseball. So there's just many different options that you can engage in no cost and be social. Or plug about our nutrition program, 60 and over. It's just a just donation of $2. Under 60 can eat for $4. But it really is designed to get people together, to talk and be social. And that piece is so important. As we age, I think there's a question in here, but I'll get it now, is the difference between someone my age who I'm still employed and I have my social network is really connected to my work. I have a lot of identity in my work. And as we age, those identities change. As someone retires, they don't have that same circle of friends. Or as you age, you lose your friends. You lose some of your, siblings, if you have siblings, and your parents. And so your circles change, which that can also lead to some depression and those changes. And so keeping yourself engaged, finding new hobbies, finding new ways to interact with friends, making sure you're engaging with your loved ones, it's really important as you age.
Shelby?
I was just going to add that typically when we talk about socialization, and we talk about the family. So when I'm talking to an individual's family members, I'm actually saying, when was the last time you reached out? When was the last time you talked to that person that isn't calling you? So there is no harm in picking up the phone or going and visiting a loved one that you're worried about. You will never regret doing that. So that's where it kind of starts. And then also, we live in such a wonderful area for seasonal free events. A great example is the balloon races, the dragon lights. I have a whole list that I could give you, but every month of the year, we actually have an event that is happening in our area. And just being engaged in the community, going to chair yoga, going to the meals at the senior center, different kind of things. And with the Sanford Center, you can always reach out to us. We actually have our community wellness programs. We have different volunteer programs where you can actually volunteer with us and out in the community. And then you can always come see me and the rest of our team to kind of have a specialized plan so that there's a recommendation so that you have a plan of how to be engaged within your life and what you enjoy doing.
So what does that look like in a little bit more, Shelby? If I'm like struggling, I can come along, visit Sanford.
So first, like Abby mentioned, your primary care is going to be your best friend. You've got to like your primary care. If you don't like, date your primary care. If you don't like your primary care physician, maybe find someone else. Because you have to have a rapport and trust. So having a conversation with them. And then you potentially could have a referral to our geriatric assessment team, who you'll actually meet with either myself or another clinical social worker, a geriatric pharmacist, and a medical provider that specializes in geriatrics. And we will talk to you about different areas of health. We'll ask simple questions like, how is your sleep? And each one of us will look at it from a different lens, and we will work together to develop a plan. If you say, I'm not sleeping well, I will give you suggestions, pharmacy will give you suggestions, and medical will give you suggestions. That's a quick example. But when it comes to your mental health specifically, there are different dimensions in different ways. Not everyone is the same. I can't just say right now that you would enjoy going to a talk therapist or you would enjoy doing grounding. We need to really talk about what matters most to you and what brings you joy and specialize your care plan in that way.
Thank you. And Abby, can I just go back? I heard someone previously to this topic thinking, or just saying to me, that the senior centres are just for low-income people as far as going and having a meal. What would your response to that be?
That's not true. Anybody can utilize our senior center. It's not based on income whatsoever. That our only criteria for a meal is 60 and over, and like I said, under 60 can still come and have a meal. All of our and why we use 60, because I know AARP is 55, Medicare is 65. Like, there's all the different definitions of what a senior is. So our definition is 60 and over based on the funding that we receive through the federal government. They define, Older Americans Act defines 60 and over as seniors. But no, there is no income guidelines, and all of our activities within our senior centers are completely free. And along with that, any of our services with senior services, so case management, homemaking, those services are also not income relevant. We are here to serve anybody regardless of their age or regardless of their income. Regardless of their income, got to be 60. But regardless of their income, that's not a consideration when it comes to services for us.
I visited 2 patients yesterday that actually received services through the senior services homemaking program, and they said it's life-changing.
Teresa, what would you like to add in terms of social networks, interaction?
I think what I would like to do is to ask you to make a list of those things that you enjoy with your partner and you enjoy with people other than your partner, so that your list is balanced. You need to have a network that includes your partner and a network outside of your partner, so that there is balance and it increases your network of support and opportunities for you to stay sharp and stay active. Whether it's the Truckee Meadows Quilt Guild, they're cutting up perfectly lovely fabric to put it all back together differently. There's a lot of math involved and planning and color and coordination. They have lovely meetings, and it gives different opportunities. I don't think that it is ever too late to learn something new and to embrace something new, because then you have another network of people with their stories that can help you.
If I may, can I ask if anybody knows of Ollie?
I was waiting for that.
Yes. Ollie's an incredible
Just
resource.
show of hands again, those familiar with Ollie. Show of hands those who are not familiar with Ollie. Ollie. There's a number in the red lines, please.
Okay, so Ollie is an incredible resource. OSHA Lifelong Learning Institute. It's led by the fearless leader Dolores, is the director over there. And they actually have activities throughout the week, out the month, where they do educational talks, they do groups that will do hiking groups, they do travel groups, they do different activities to engage older adults in lifelong learning. I highly encourage you to get involved with them. If there is an activity that you enjoy doing, they don't offer, talk to their staff and they will make it happen. So if I can just plug that.
Yeah. Any other community organisations people might want to get involved in? Ollie's obviously fantastic. Any others come to mind? Senior Centre.
Seniors in Service is a good one. I would also mention our programs with the Sanford Center, like I already mentioned. I would be happy to talk more about them afterwards. I would also say volunteering. Once again, volunteering. If you can, if there's something that you enjoy doing, and or maybe your expertise, you miss doing those things, but you don't want to go back to work part-time or full-time, give your expertise and we'll find a place for you to volunteer.
So what other approaches can we individually take if we realise maybe we're struggling a little bit? There are other factors like diet, exercise, anything there that we can look at that might be impacting our health mentally?
You want me to start?
Yeah.
Okay. So you want to think about how you're coping. Everybody uses that term these days, but it really is the best way to ask you this question. How are you coping? Because we are very resilient beings. Are you coping with this poor sleep? How are you coping with that? Are we taking a prescription medication to fall asleep? Or are we utilizing reading at night? Are we on our phone until late into the night looking at the blue screen? So we really want to think about how we're coping. I always like to use the analogy, treat your body or your mind or your life like a plant. What are you feeding it? How are you hydrating it? How are you taking care of it? It likes the sunlight, right? So getting out, moving, drinking water, feeding it nutritious food, exercise, engaging. You know, there is studies out there where plants actually grow faster if they're talked to. Believe it or not. And so, just like plants, we like to be talked to. We're social beings.
I think the more that we can have that phone a friend, call somebody that you know may need to get out of the house and go do something. I know that we have several staff who have started gardening again, started getting out to nurseries and planning it so that they can be more self-sufficient. One lady has embraced having her own flock of chickens. And sharing information about what you're passionate about is very helpful. One of the nurses brought in a study that said, I'm going to start growing rosemary. I'm keeping it in containers so it doesn't take over. But there's a study that showed that just smelling rosemary for a couple of minutes a day helps your neurons connect better in your brain. So suddenly I'm seeing people sharing rosemary scented lotion and shampoos and everything else around the unit. And nurses brought in rosemary oil and other things to put on cotton balls in patients' rooms, or a little sprig of rosemary they asked the lady in the kitchen to put on dinner trays, because nothing's worse than a missed opportunity, right? So we want to try everything. Let's see if this study will work for anybody in the room. It may for 5 people, and then it's wonderful. It may for one person, and for that person it makes a difference. So we're always looking for those things that can make a difference, and sharing information about your hobby and your passion with someone else starts a conversation and can help somebody else.
One of you had mentioned hydration when we were talking. You mentioned hydration.
Watering the plant.
Watering the plant. Can you just talk a little bit
And
more about that?
that doesn't mean including our coffee, right? So, I mean, Teresa, you can speak to this, of course, but I see a lot of individuals that will actually say, well, I drink coffee throughout the day, or I drink Diet Coke throughout the day. Does that count? I will ask Teresa that.
That does not count. And some of those things are actually things that help you become dehydrated. because of the other content. So water is great. Even if you have to add a flavor of Crystal Light or a bit of lemon because water is not something you normally go to as your beverage of choice, it is very important. And it's one of the things that we find in our patients with dementia, that there isn't as much stimulation to think about the simple fact that I'm thirsty. So we are putting cups of water on every tray and always offering water because it's one of the first things that's forgotten. So again, watch and encourage as much free water as possible.
Why is that so important when it comes to our mental health and being hydrated?
Staying hydrated and having a correct electrolyte balance within your body is incredibly important, and it's one of the things that we do as we look at someone's overall health. We want to rule out any metabolic kinds of things that are wrong, because there's several things that can lead to confusion and hallucinations and other things. I can tell you in the last 6 months, I've had 3 women admitted with psychosis as a diagnosis that 3 days later said, why am I locked up with crazy people? Because they got antibiotics and what they had was a urinary tract infection because they weren't drinking enough water. So staying hydrated to help prevent all of these other things, we need to add clarity around someone's overall health to make sure it's not an easily fixable something, because I don't want anybody to have a diagnosis that they don't need that isn't going to be helpful to them. Once a diagnosis of dementia is added to someone's list, they can't sign any legal documents anymore. We don't want those problems to then invade other parts of someone's life.
Do most of us drink enough water?
Probably not. Some people do. But if you're feeling a little lightheaded, you're feeling a little tired, chances are, just like your car, if you don't fill it up with gas, it isn't going anywhere. If you're not filling yourself up with water, you're not going to go anywhere either. There's a scale that I saw at a fire station. On the back of the stall doors, they have a urine color chart for the firefighters. And if it is not light yellow, you're not hydrated enough. The darker your urine, the less hydrated you are. And that scale is promptly there so that they make sure that everybody is healthy and they're functioning as best they can mentally.
Thank you. So you mentioned about functioning mentally, having capacity to be able to sign legal documents. When we were talking, you brought up how important it is to have a advanced care directive and a power of attorney. Can you talk a little bit more about that, Teresa?
Certainly. We have, it's one of the things that we struggle with patients that haven't had conversations with family about what they want done if they're unable to make a decision. And there are some temporary things that can happen where you're not able to make a decision. But some of those things that affect mental health, dementia is a prime example of one, won't allow any other document. So however many of you were here in April when it talked about advanced directives of planning, if you haven't acted upon the things that you learned there, I would strongly encourage you to do that now. The most heartbreaking situations for me are the patients that come who don't have an advanced directive, don't have a power of attorney for their health care or their finances identified, and then they have a diagnosis of cognitive impairment. And once you're admitted to a psychiatric unit, you can't sign any legal documents anyway because you're admitted to a psychiatric unit above and beyond outside of a mental incapacity. So putting these things in place ahead of time is very important. We had a lady come to us, but she only came to us after her husband passed away suddenly. He had been covering for her memory loss for several years, so much so, and he was so gifted at it that her children didn't realize. And suddenly, mom had the crock pot on the stove with the burner turned on and the fire department coming when the children realized it's not safe for mom to be home alone. Because he was such a good partner in taking such good care, but he didn't know how to ask or say that he needed help. I don't want anyone in this room to have to go through a situation like that. And for this daughter, there wasn't a living will, there wasn't a trust. She was their POA for healthcare because she was a nurse, but a bank wouldn't give her access to things for the account. All of those things were then a struggle. And to become a guardian of your own parent is still a 6-month process in Washoe County. So I really would encourage you to take care of those things so that we know your wishes when you're able to tell us what those wishes are, and to put things in place for succession planning of what you want done with things.
That goes back to the conversation about having an open conversation about death and dying, what you want, what your wishes are, who you want to be around, who you want to make those decisions on your behalf. One thing I always like to make sure that everybody is aware of is these things do not go into effect unless you're incapacitated or unable to make your decision making. A lot of people ask me, well, I don't want this just to say this person has power of attorney over me immediately. That is never going to happen unless you're unable to make your decisions. And that can also change. One day you can, and one day you can't. The medical providers know how to assess for that. And so once again, this documentation of advance directives do not take away your rights at any point.
Thank you, Shelby. So before we go to audience questions, is there anything we haven't covered that you would like to add?
I feel like we could talk forever.
I have one more thing to add, because I didn't really talk about a whole lot, but the social isolation piece of it, and how it's a, and Shelby, because my brain's not working.
Yes, social determinants.
Thank you.
Say that one more time.
Social determinants of health.
So, I would like to think that none of you were socially isolated since we're out here today on a lovely Thursday morning, but recognizing that in possibly friends, neighbors, and those sorts of things. And so those that cannot get out of the house, there are those services there for them. I mentioned a few, but again, it goes back to the income thing. Many people believe that the Meals on Wheels program is an income-based program. It is not, and anybody can make a referral for anyone. So if you know people who are socially isolated that cannot get out of the house, now if they can, I encourage you to get them out of the house. But there are those services in the Meals on Wheels program. People come once a week, they get to know them, they can talk to them. Same with our homemaker program that Shelby mentioned that she just talked to 2 clients. They come into your home and do light housekeeping. So it's not, hope isn't lost. If you're stuck in your house, there are those services as well. But be aware that social isolation can be very damaging to anybody, regardless of your age.
Does that lead to depression?
Yes, it goes back to kind of the beginning of this conversation. It can lead to so many things, to include depression.
Transportation, also, I know that we could kind of talk offline about the resources out there, but that typically becomes a risk factor. If someone is no longer driving and feels isolated within their home because they cannot get to activities, there are resources out there, so feel free to reach out to us.
Thank you. Teresa, anything else we haven't covered? Okay.
If you have a question, raise your hand and our mic runners will get to you, and we'll start down here.
Thank you. My question is about dementia. We hear so much about it, but I would like to know from our panel a little bit of what's the difference between when it's just normal, everyday slowness or forgetting little things. When does it move to dementia, and does dementia still mean automatically moving to Alzheimer's?
Who would like to take that?
I need to tell you that there are over 200 different types of dementia. Okay, it is so involved, and I think for a lot of people, Alzheimer's is interchangeable with dementia. Okay, so there are just so many types. There's a Lewy body dementia. There is vascular dementia, people who have had high blood pressure for years or other things. You can fall into different categories where we know different types of therapy and different medications may help manage better than others. And for some, there isn't something that can help, and they progress very rapidly. Others do not. Okay.
So how do we determine whether we're just dealing with everyday, maybe forgetting things as we age versus having dementia? Who do we go see? If I'm concerned?
Talk to your primary care. And we do have individuals that come see us at the geriatric assessment, or our comprehensive geriatric assessment. And that could be like what we would call their baseline. We want to see where you're at, and then we can follow along throughout the years if things change. But I would agree with Teresa, there is a lot more to uncover before we jump to a diagnosis.
So the fact that I might not be remembering words or people's names, does that mean I have dementia, or I'm just... No?
No, it really doesn't.
Relief.
It is a big relief, and there, clarity has to do again with your hydration and your sleep hygiene and your ability to stay connected to other people so that you're moving things from short-term memory to long-term memory. And if you've met one person once 6 months ago at a church barbecue, I wouldn't expect you to remember their name. Some people do tricks if they went through Dale Carnegie courses or were salespeople and say, I need to remember that I need to use that person's name 3 times within our first conversation, and then I'm more likely to remember their name later. Right? So there are some of those kinds of tools that some people learn through the course of their working career that then helps them later.
Thank you.
And there are also life events that can impact your stress level, which can impact your memory as well.
Well, I actually have a confession because I've been impacted. We had friends over for dinner last night, and I think I drank way too much white wine. So I'm suffering from a lack of hydration, and I'm really struggling today, and I know it's because of lack of hydration, so yeah.
And alcohol use.
Yeah. Alcohol was the starting problem, yeah. Lack of hydration. Over. Yes.
Hi there. My name is Kim, and I want to I want to really appreciate this because I feel so strongly in it. And I wanted to know.
Can you tell us who you are, Kim?
I'm Kim Spoon, and I have done advocacy work for seniors with mental health for the last 30 years. I'm now retired. And as a member of the City of Sparks Senior Citizen Advisory Committee, Janelle's came in and did a presentation for us, and I had asked them at that time if they ever did any presentations for seniors on mental health issues. And that's kind of why we're here today, and I am so pleased to see so many people, because I know the concern is out there. So I just am so pleased to see you, all of you here. And I know most of you.
Just give Kim a round of applause, because she's the whole reason we're here, so thank you, Kim.
No. In listening to all this, I did have a couple things. I was wondering if it's okay if I maybe mention some things, if that's okay with the panel. And this is such a huge thing, the mental health capacity, because most of that work I did as a private guardian. I also worked for the county as for the public guardian's office, and that's kind of where I learned the trade and went out privately and did it for another 20 some odd years. So I have dealt with all of this so many times over and over. Senior Bridges, we were so happy when they started, because what we had, and this is important, we had another psych hospital that we would have to take our seniors to, and they were in the midst of 25-year-old male psych. It was just not healthy. So having Senior Bridges, I think we filled their beds in their first time. They didn't have a whole lot when they first started. So they have been a remarkable resource for this community for years. And so I really am happy to see you. And then when UNR started with the San Francisco Center, it was just been a really growth period. The last 3 I've worked with Abby. So I just am so thankful for all of you out there and the Janelles for doing this. But there are a few things that I wanted to piggyback on this, if that's okay. All things so important. One of the things I want to bring up, a little more practical issues, are suicide. Of course, our job was to help prevent that and get involved before that happened. One of the things as partners, neighbors, whatever it is, the village that needs to be out there for our seniors, look at what's available for them, especially for the men. If there's guns in the house, this is perfectly suicide prevention stuff, but very important for seniors. Look at whether there are guns. Should the guns be gone? If there is suicidal ideations or something out there that's pointing toward that. Medications. A lot of seniors keep old meds. They don't want to, they add on to their meds to keep their meds. They don't have to order it so often. Not good. If they have old meds that aren't being used, don't need to be used, try to see if you can get rid of them through their physician, whatever it takes. Get rid of some of these old meds, because what they do when seniors get despondent, if it's right there, just like a gun, if it's easy to get to, they're going to grab a handful of pills and take them. Try to make it until they can get the help they need. Take away what will enable them to commit suicide if possible. Okay, just a little practical thing there. Psych meds. You touched on this a little bit, but our primaries are so important, but they don't necessarily deal with geriatric psych issues. Many psych meds are not appropriate for seniors, but your primary may not be aware of that. So I think it's really important that if you're strictly going to your primary for all your meds and mental health care, to make sure they understand whether or not the meds they're getting for mental health, Prozac, whatever it is going to be safe for you as a geriatric, because it can cause a lot of adverse for seniors. Our brains are different. If that's how it works. So be careful about what you're getting. If you hadn't and can go online, if you have a child or grandchildren, especially now, have them go online. Research these meds to make sure that they're healthy for a geriatric mind. Very important.
Kim, can I add to that just real quick?
Yeah.
If you were talking with your primary care and you had something going on with your lungs, they would refer you to a pulmonologist, and you would make sure that the medications you were taking were cleared by your pulmonologist. So similarly, if someone is struggling with their mental health, get them connected with a psychiatrist. We do have a gero psychiatrist in the area, newer to the area, and she's incredible. And so I would encourage you to work with the psychiatrist and the therapist, ideally, to do some of that proactive safety planning.
Absolutely, but I have also seen psychiatrists in this area who are not familiar with geriatric care.
Yes,
so
we do have
important,
the new geriatric.
Right. So even if you're seeing a mental health professional, be sure that they're aware of the geriatric component to the medications that they're giving to you. One of the big things that we had to deal with so often was in the mental health capacity of seniors is change. Change sometimes has to happen. Doesn't mean it's bad. It can be hard, but it doesn't mean it's bad. People think they have to stay in their home, they can't leave, and this is where they should be. I think it's important for mental health issues to understand that living in your home is not always the best place, nor financially can you do it. If you need more home care than you can afford, you're not probably going to be able to live in your home. And so it all kind of comes down to finances. And I don't know if you've talked, I was a little late, so I'm not sure if you mentioned this. Home care goes about $20 to $25 an hour right now. So many people, if they need more than 4 hours a day, aren't able to do that. So sometimes they have to move. That can cause a lot of mental health issues, despondency, anxiety, depression, this sort of thing. It doesn't mean it's bad. It's hard, but it doesn't mean it's bad. Our assisted livings, our senior independent livings where you can have meal plans are in this area. Some of them are really great. And I really encourage people, if they're reaching that point where that might be a possibility, Get out there before you're forced to move through a hospitalization or whatever. Get out there and look at some of these. Morningstar, I saw that on there. There's so many out there that are wonderful assisted living, senior independent living. But do it, be proactive. Get out there and do it on your own so you're not forced to do it from a hospitalization or whatever. Because failure to thrive, people get so depressed they're not eating when they move. It happens way too often. So please be proactive if that's something that you're concerned about. RTC, you had mentioned the transportation. We have some wonderful programs for seniors. Call RTC if you can't drive. The losing your license, holy moly, talk about depression and anxiety. There are options out there, but call RTC. There's groups, Abby, or I don't know if any of you could probably talk about, like, is it Nevada 4 or 4 Nevada? There are so many programs out there.
N4, Northern Nevada Neighborhood Network. Oh, I think I got it right.
They have tickets for Ubers.
Yes. And so does RTC. Yeah. They have, it used to be called Senior Bucks or Tacky Bucks, but they have many options. There are transportation options out there. And again, not necessarily with any income qualifications.
Sanford Center for Aging also has a volunteer transportation program as well.
And the VA. For vets and stuff, they also have a transportation, not very wide, but it is out there. So please look into these things. Again, for veterans, the VA has some excellent mental health programs that I would really encourage you out there to, again, be proactive as a spouse or partner or whatever, if you see it, or as a vet yourself. If you can do this, reach out to them as well. Another thing that I didn't hear you talk about is exploitation. When people are starting to maybe get into confusion, into areas where they're just not as sharp as they used to, they are prone to being exploited. So there are so many scams out there. I just want to kind of warn people to make sure that family is aware of what you're doing, that you're not out there getting involved in some scams and stuff, because you might be a little more confused than you normally would, or not just as clear as you used to be. So do not become a victim. Reach out and make sure, if you have any questions, just say no. You can always get back to them. If you can't get back to them, it's a scam. Okay, so that is so important for people who are starting to get a little confused, or just as we get older.
Thank you so much, Kim, for sharing.
Thank
really
you.
Appreciate it. Thank
That's
you.
great information.
Lots of great information there. And just following on just what Kim said as we go to the next question, that workshop on suicide prevention, I'd really encourage you, if you have the time, to come along, because it's not just about us. I have no plans on committing suicide, so I don't need to go. It's about other people, about a partner. It's about an adult child, a grandchild, a neighbour. It's just knowing more about what to look for in others and how to help them, not necessarily about yourself. So if you're able to come, I would encourage you. Yes.
I've heard from AARP that brain exercising and training is very important, such as learning a new language or doing other things, cognitive games and things that you can get online. How important is that to people who are our age?
Question.
I think it's extremely important to keep exercising your brain and the processing of information and problem-solving skills. The better you are at problem-solving skills, the less likely you are to fall and have other psychomotor issues, because you're thinking ahead. Like your next move in chess, where I'm going to finish this crossword puzzle or do Sudoku. Any of those types of things that help you with problem solving. One of the first things that people sometimes struggle with is doing math in their head. So, and most of us were raised to know all of our multiplication tables and everything else, and we survived without a phone and a computer, and I know what a dial-up phone is used for. So, like I'm saying, the most that you can do to continue your problem-solving skills And languages are great for that. You've got to think about, is this the subjective case, accusative case, dative case? How do I put together a sentence in Spanish versus French versus German? And I learned more about the English language taking German as a second language. So please, I would encourage you all to do that.
Vic?
Hello, I'm Rosalie Henry, and I just wanted to make one quick comment about hydration and lymphatic work, because that's what I do. And basically, it doesn't matter how skinny or heavy you are, how much fluid you have in your body, how it moves is totally different. In the very beginning when I did lymphatic work, I had a woman come in that was fairly obese, and 2 days later she called me from the hospital saying they told me I was dehydrated. So it's how your body handles the fluid that's more important than the quantity that's there.
Thank you for sharing that.
My question is, how does one know the cost involved with all of this resources you have on the back of the page? How do I know what it would cost me if I called any of these? I know that some of the Senior Citizen Act are free. I heard you say that, but certainly not everything. Or is it?
I'm pretty sure, and feel free to come up to me afterwards, or I'll be happy to give you my card. I'm pretty sure everything we provided was a free service, but I'd be happy to walk you through any of those services.
I think it was Teresa that mentioned psychomotoring and issues with the brain commuting with the body. Are there
Hold it closer.
See a neurologist, or are there specialists that one should go see? And neuropathy is an issue, but there's all sorts of other issues. How can we get help?
I think it starts with your primary care provider. And again, think about those 4 M's. What do I want my mobility to be? My mentation, my medications. There are more advances for treatment of neuropathies without the use of narcotics in order to be pain-free, so that you can get up and move, and alternatives. And sometimes it's one of those, if you don't use it, you lose it. The more you move, a body in motion stays in motion. So I would encourage you to be as active as possible. They have not only chair yoga, Pilates, I mentioned Tai Chi before, meditation, good old-fashioned calisthenics, and do what you can do. You can find people that lead those things on YouTube, if you can add that to your television, or if there's something at Parks and Rec or at one of the local senior centers. Adopt a dog from the SPCA and walk a dog. Walking is some of the best activity that you can have. And I think I heard somebody say, we have 3 of them, so you may be able to borrow a dog for the afternoon. Or, do some house sitting and dog walking for people. There were a lot of people that rescued dogs from the SPCA during COVID, and then when they went back to work, suddenly they didn't want them anymore or didn't plan ahead. So there are many out there.
Vic, could you just get a mic back over while we're doing that?
So his question is, what other organs can be involved where the brain's not functioning and there's not communication? And I think infections are one. I would encourage all of you to, with your primary care provider, go to see the optometrist, investigate an audiologist if you're having difficulty hearing. Is it simply wax buildup and something that your primary care provider can take care of for you? Because having your senses in the best working order possible is going to help you with every other psychomotor kinds of things. I would look throughout the house. The throw rug may be pretty, but it also could be a trip hazard. So rethink what you have around that will help keep you safe. And if you need to put some non-skid something underneath it, if it absolutely has to be there, think about those things a little more thoroughly. And then if there are opportunities for health fairs where you can get lab work and those kinds of things done, keep track of your thyroid and your thyroid function, because there is something called thyroid psychosis that can be a metabolic thing to take care of. So those would be other kinds of things.
The B vitamins, I noticed they're really B vitamins are really deficient as we age, and I've been put on a B complex. What else can you do to help your nervous system?
B vitamins is one that we see that's a deficiency. We also see vitamin D as a deficiency, and you can fix that by getting outside in the sunshine, and you can take a supplement of vitamin D in the winter time when there's less actual sunlight. That's good. But you have to remember that vitamins A, D, and K are all fat-soluble vitamins, so you need to have food with those. B vitamins, if you take too many, you just have pretty yellow urine. It all goes out of your system, right? But the fat-soluble vitamins, A, D, E, and K, you need to have with food to help break down and get those mobilized to where you need them. One of the other things that we have found, rather than having a medication specifically for sleep, is using magnesium, which is a mineral supplement. 200 milligrams of magnesium helps people get far better rest. A drink at night, alcohol is not going to help you get better sleep. Okay, it may help the annoying neighbor's noise be less annoying, but it's not going to help you with a better night's sleep.
Thank you.
And a great resource when it comes to supplements or medications with our Sanford Center for Aging Medication Therapy Management, our geriatric pharmacist will actually review all of your supplements and medications and advise on what is best for your situation.
Thank you for writing that.
I noticed that you use the word mentation. I have not heard that before. What does that mean? Mentation.
Mentation. So for the Institute of Healthcare Improvement, when they talk about the 4 M's, they're looking at someone's mentation, how clear somebody is in their thinking, how well they do problem solving, do they have episodes or bouts of confusion. We look at someone's mentation. How alert is someone? How somnolent are they? Because one of the things that somnolent, wanting to sleep, be disengaged, passive, what we look for is medication interactions and medication and herbal interactions. And really a lot of it we find is reducing the dose. But we do have our med reconciliation. Well, we'll look at everything that someone is taking. We can import into our hospital record last medications dispensed from most all pharmacies. Unless you do mail order or the VA, they don't participate. We can see those dosages, and we also know when something was last filled. So if someone brings us a bottle and more of it is missing than it should be, then we can be suspicious and look for other things, right? And cost is always a big deal. So if your medication is adjusted or changed, we really do need you to set that aside and have the pharmacy take care of recycling it the way they are supposed to. So we have had patients bring us a whole basin full of medication bottles to sort through. So it's really been helpful for us to work with the pharmacy. Now, when it comes to medications, there are psychotropic medications, there are mood-altering medications or mood-enhancing medications, and it depends on your cardiac status which pathway we get to use. So we do a 12-lead EKG. So if you have any cardiology component to your medical picture, know that we do that to be safe, because if a certain measurement on your 12-lead EKG is beyond a certain measurement, we can't safely prescribe a certain classification of medications, and we won't. Okay.
Thank you. Any questions on this side? Gentleman down here, Debbie, his hand up. While you're getting there, Ricky?
Just as a follow-up to...
Talking about medications.
Go ahead, Ricky. We'll go there and then there. Ricky?
Talking about medications, is it true that even simple things like NSAID, which is your Tylenol, aspirin, and proton pump inhibitors like Prilosec and Acifex, do they put you at risk for dementia or Alzheimer's? Because that's what I've been reading.
No, not that I've seen or that we've experienced. I think they're looking at things in excess, and some of those things are not made to be a daily occurrence, right? If you're taking something like that over the counter daily, is that really what your primary care doctor wants? It's not designed to be something that's taken daily.
Well, people with arthritis are always taking NSAIDs. And so, I keep up on the literature for medicines, and I'm a nurse too, so. But that's what I've been reading, are those simple things like NSAID and proton pump inhibitors, where you have GERD and reflux, and so, unless you change your diet, you won't get over GERD.
Thank you. I'll look for some studies to see. It's not something that has come up recently.
This is for you, Teresa. How closely does Northern Nevada medical centers work with Northern Nevada medical group doctors? And what is the relationship, if any?
So Northern Nevada Medical Group is a separate arm of the organization. We transmit information electronically to those providers if one of their patients is hospitalized in the hospital. If I need to make a phone call and use my mom voice to a provider, I can more easily if they're with the medical group, to say, what were you thinking? Why did you do this? We have hospitalists that are physicians that are internal medicine board certified physicians that take care of patients in the hospital, so the medical group physicians can stay in the clinic so that people don't have as long of a wait time, and it's a better follow-up appointment time. So we do impress upon them the need for people to have soon follow-up appointments, and that some slots are left available so that things are more seamless from that perspective.
Thank you. Any other remaining questions?
Just not a question, a comment. Is this mic coming through okay? I'm a retired pharmacist. My name's Judy, and every April and every October, 6 months apart, I think it's the second Saturday in May, or in if those 2 months, keep your eyes open on all the public media for advertising for Drug Take Back Day. Well, most of us have a lot of drugs hanging around that we took once and we don't take anymore, and we don't know what to do with them. You don't want to make the fish sit, dump them down the toilet. So, but look for those drug take back days. They're really great. They don't take needles or anything sharp, but any kind of medicine, original package, nothing. You don't have to prepare it or take your name off. It all goes to a giant incinerator.
Thank you for sharing that. Was anyone else aware of that? Few people, CDC? Okay, great. Another.
Thank you. Teresa, you mentioned there were 3 medications.
Can you just hold your microphone a little closer?
You mentioned there were 3 medications, at least 3, that seniors should not be taking because it causes dizziness, or do they interact or something? Would you say what they are again?
Those are medications that would be considered a benzodiazepine. So anything that falls into that category. So our retired pharmacist can help us. Would be Ativan, Haldol, Xanax, muscle relaxant kinds of medications. We watch for those kinds of things as well. Flexeril.
And most of those sorts of medicines also, their activity is greatly increased if you take them with alcohol, because they work synergistically, i.e. one increases the bad side effects of the other.
Right, they can potentiate each other if you have alcohol. Look for the bottles that you have at home that have a warning about don't drive while taking this, don't drink alcohol while taking this. And you can take your medication list and discuss with your pharmacist these interactions and dosages. One of the challenges that we have is skilled nursing facilities in the state of Nevada and in the state of California. They must show that they are reducing the amount of any type of benzodiazepine class drug over the course of months when somebody is there. And they do this because they don't want any organization or facility to be chemically sedating anyone, because that's the potential for these. We want people to be up and active, so they're looking at these. And for some patients, they need a certain dose. So there are times where we will write letters or we will redo and reorganize medications for someone so that they can be the most active, functional individual possible and justify the need for that. But it is rare that we do that. You're welcome.
Do we have any remaining questions? We've probably got time for maybe two more questions. One over here.
This isn't actually a question. One thing that didn't get come up very much was the fact that, you know, for especially people who live alone, having a pet, and we have lots of them, really makes a difference.
Thank you for sharing that.
Pets can be
Three
amazing.
four-legged children.
Yeah. Pets can be amazing companions.
Well, on that, I'm just going to say thank you so much for all being here. If we can have a round of applause for our panelists and you for all being here. And we hope to see you next month and have an amazing rest of the day. If you have any one-on-one questions, feel free to come up to our panelists. They're going to hang around for the next 15, 20 minutes. And yeah, have a great rest of the day.